the blood starts out through the pulmonary vein, and then it is sent into the left atrium through the mitral valve to the left ventricle. Then that is sent to the aorta. The blood is sent to the body. Then the body sends back the blood through the superior vena cava and the inferior vena cava, and then that sends it to the pulmonary artery, so it'll be sent to the lungs to be oxygenated. Now, this is comparing the normal tricuspid aortic valve in adults with the aortic stenosis bicuspid valve in infants. As you can see, the normal one has 3 openings, and the aortic stenosis one only has 1, because babies with aortic stenosis do not develop the 3 openings. Next, we will be showing the open and the closed aortic valve normally. As you can see, it's just a triangle. Next, we will show the aortic stenosis in infants and how it is open and closed. And it is a very small opening, that it's only 1 opening, and it only has 2 openings, not 3. Now this is going to show you how aortic stenosis can develop in adults, and that it's not only exclusive to infants. So it starts off normal, then the calcium keeps building up, and the opening. Now for some background information on aortic stenosis. Aortic stenosis is one of the most common and most serious valve disease problems. Aortic stenosis is a narrowing of the aortic valve opening. Aortic stenosis restricts the blood flow from the left ventricle to the aorta, and it may also affect the pressure in the left atrium. Some people, infants, have aortic stenosis as a result of a congenital heart defect called a bicuspid aortic valve. This is when 2 cusps grow instead of a normal 3. Another cause may be that the valve opening does not grow along with the heart, which makes the heart work harder to pump blood to the restricted opening. Over the years, the defective valve often becomes stiff and narrow because of calcium buildup. This condition more commonly develops during aging, as calcium or scarring damages the valve and restricts the amount of blood flowing through the valve. The wall of the left ventricle may also show muscular thickening because the ventricle must work harder to pump blood through the narrow valve opening in the aorta. The thickened wall takes up more space inside the lowered heart chamber, which allows less room for an adequate amount of blood to be supplied to the body, which in turn may cause heart failure. Early treatment can help to reverse or slow down the progress of this disease. If there are no symptoms, or if symptoms are mild, a healthcare provider may advise that the best course of action is to simply monitor and follow up on any changes. However, anyone with aortic stenosis should be checked with an echocardiogram. This is a heart ultrasound to confirm the safest and best options for treatment. Possible treatments may include valve repair, a surgical technique used to fix defects in heart valves and valvular heart diseases, and provides an alternative to valve replacement, or valve replacement, the replacement of one or more of the heart valves with either an artificial heart valve or bioprosthesis. This is an alternative to valve repair.